The story we're about to tell you tonight is about the most impossible operation in medical history. 4 bullets. 6 minutes. 1 surgeon. But this surgeon's hands had never been seen like this before. Because these hands used to hit targets from 800 meters away with a single shot. 73 confirmed kills. 99.2% accuracy rate. The U.S. Army's most lethal sniper. And tonight, she would save a life with the same precision. Nobody knew who Dr. Sarah Williams really was. Until she made that move. Before we dive into this incredible story, if you believe that the most powerful transformations come from using our darkest skills for the brightest purposes, hit that like button. And if you want to hear more stories about hidden heroes who walk among us every day, subscribe and ring that notification bell. Trust me, you won't want to miss what happens next in this story. Now, let's see how a ghost sniper became a miracle surgeon. Dr. Sarah Williams. 34 years old. Neurosurgeon at one of New York's most prestigious hospitals. Her colleagues called her Golden Hands because she had never lost a surgery. Every morning at 7 a.m., she would arrive at the hospital. She would drink her coffee, check on her patients. Everything seemed normal. But nobody knew that. This calm, kind doctor had a deadly secret buried 8 years ago. Sarah's colleagues never suspected her. Dr. Michael Chen, the chief of surgery's right hand, always said this about Sarah. This woman is a born surgeon. Her hands are worth their weight in gold. Nurse Jennifer also thought the same. I've never seen anyone work with hands as steady and confident as Dr. Sarah's. Even anesthesia technician Robert was amazed by the precision in Sarah's movements. It's like every movement is calculated millimeter by millimeter, he would say. But none of them knew that this precision had been developed years ago for a completely different purpose. 8 years ago. Syrian border. Night 23:47. Wind speed 25 kilometers per hour. Distance, 847 meters. Staff Sergeant Sarah Ghost Williams was watching her target through the scope. The enemy commander was about to exit his tent. One shot would save the lives of 3 innocent civilians. Staff Sergeant Kevin Miller, who was with Sarah that night, now lives as a retired soldier in Texas. If he were to tell what happened that night, he would say, Ghost's hands never trembled. Even in 25 kilometers per hour wind, her breathing was perfect. When she was targeting through the scope, it was like she could stop time. Sarah breathed in, held, finger on the trigger, and perfect hit. From 847 meters away, on a windy night, with a single shot. This was Sarah's 73rd confirmed kill. But that night was also her last mission. Because after that operation, Sarah was wounded and stayed in the hospital for a long time. During the treatment process, watching the doctors, seeing the life-saving hands, she made her decision. From now on, she would use these hands only for healing. The return process hadn't been easy. Sarah first learned that she needed to complete medical school. She had started university with a civilian identity, hiding her military background. For 6 years, she worked day and night, graduating with the highest honors. During her residency training, professors were amazed by her natural talent. This girl is a born surgeon, they would say. But Sarah knew that this talent wasn't natural. It was the precision developed for years to hit enemy targets, now transformed to save lives. Back to the present. New York, November 15, 2024. Night 2:47 a.m. Dr. Sarah was on night duty. At this hour, the hospital was usually quiet. Sarah was reviewing patient files, sipping her coffee, and going over the next day's surgery schedule. The emergency room was usually calm at such hours, with only occasional alcohol poisoning or heart attack cases. But tonight would be different. Suddenly the hospital doors burst open. Paramedic Tom Jackson ran in shouting, "Doctor! Emergency case! Multiple gunshot wounds!" Sarah immediately stood up. Such cases were rare in New York, especially at this hour. On the stretcher lay police officer Mark Davis. 28 years old, married, with a daughter. He had taken 4 bullets. 1 near the heart, 1 in the lung, 2 in the abdominal area. Nurse Rebecca was quickly giving the report. Pulse dropped to 40. Blood pressure 60/40. Severe blood loss. Multiple organ injuries. Sarah quickly examined the patient. His pulse was weak, breathing was shallow. He was opening and closing his eyes but couldn't speak. Sarah immediately understood the situation was critical. Dr. Sarah was rushing to the operating room while examining the bullet wounds. And suddenly she stopped. The position of these bullets wasn't coincidental. This was a professional attack. The bullets had been strategically placed. The bullet that hit the narrow area between the heart and lung had been fired with millimeter calculation. The 2 bullets in the abdominal area were also positioned to affect vital organs. This wasn't a random shootout. This was a targeted assassination attempt. And the precision required to heal these wounds. With normal surgical methods, it would take 4 to 5 hours. This man wouldn't last 30 minutes. The blood loss was so severe that every passing second was vital. Sarah stood at the operating room door thinking. She needed to do something extraordinary to save this case. She entered the operating room. The team was ready. Anesthesia technician Robert, resident Dr. Lisa, operating room nurse Amanda, and perfusionist David were quickly completing preparations. But Dr. Sarah noticed something. The hand precision required to remove these bullets was impossible for a normal surgeon. Because the bullets were positioned at such critical points that a millimeter error would mean the patient's death. But Sarah wasn't a normal surgeon. She took off her gloves. Put on new ones. But this time, her position was different. Sniper stance. She spread her feet shoulder-width apart, controlled her breathing, relaxed her shoulders. Just like she did 8 years ago when targeting through the scope. Anesthesia technician Robert asked, "Doctor, what are you doing?" "This position is a bit different." Sarah replied, "Listen to me carefully. I'm going to show you something outside of normal surgery. Don't talk, don't move, just follow me." The team members looked at each other. This tone was one they had never heard from Dr. Sarah before. Hard, determined, commanding. And at that moment, the ghost buried 8 years ago, returned. First bullet, near the heart. In normal surgery, it would take 45 minutes. Dar. Sarah's hands were moving with the same precision as 8 years ago. Just as she targeted through the scope, now she was targeting the bullet. She controlled her breathing, listened to the heart rhythm, calculated the patient's blood pressure. She placed the tip of the scalpel exactly 2 millimeters next to the bullet. One movement, sharp, precise, determined. Removed in 90 seconds. Resident Dr. Lisa whispered, "How is this possible?" But Dr. Sarah didn't stop. Second bullet, left lung. This bullet was more difficult because it was embedded in lung tissue and moved during breathing. Sarah was calculating the patient's breathing rhythm. Just like the wind calculation she learned as a sniper. She breathed in, held, moved at the exact moment of expiration. The second bullet came out. Nurse Amanda was watching in amazement. This speed and precision wasn't normal. For the third and fourth bullets, Dr. Sarah was now in full concentration. Her eyes were focused like using a scope. Her hands moved in perfect rhythm like a metronome. This was no longer Sarah's surgery, but Ghost's surgery. The third bullet was at the most critical point of the abdominal cavity. Between the liver and kidney, right near the major vessels. One wrong move could cause internal bleeding. Sarah placed her hands around the bullet. She could feel the vessels with her fingers. She could count their pulses. Just like she used to count her own heartbeat before pulling the trigger. The fourth and final bullet. This was the most difficult one. Because it was near the spinal cord. A millimeter error could paralyze the patient. Sarah took position. Regulated her breathing. Calmed her heartbeat. And at that moment, she remembered the most difficult shot from 8 years ago. 847 meters distance, windy night, innocent civilians next to the target. That night too, she had moved with the same concentration, the same calmness. 6 minutes and 23 seconds later. Dar. Sarah made the final stitch, patient is stable. The operating room was frozen. 4 bullets, in 6 minutes, without any complications. This had never been seen in medical history. Team members were looking at each other. Who is this woman? How did she do this? This isn't human. Perfusionist David, with his 15 years of experience, said, I've watched thousands of surgeries. I've never seen anything like this. This woman's hands aren't gold, they're diamond. Anesthesia technician Robert thought the same, the doctor's concentration is on another level. It's like she has control over time. The next day, when the patient regained consciousness, his first question was, who saved me? Dr. Sarah entered the room. Normal doctor clothes, calm smile. Sarah introduced herself, I'm Dr. Sarah Williams. I'm the one who operated on you. Mark looked at her. There was something different in this woman's eyes. Calmness, but also a hard determination. Mark replied, Doctor. I'm on the police special operations team. I've been in this business for 12 years. The precision required to remove those bullets. This can't be done with just medical knowledge. This level of hand control requires special training. Sarah listened quietly. Mark continued, the people who carried out the attack were professionals. The placement position of the bullets isn't coincidence. It was a targeted assassination attempt. Mark asked curiously, who? Are you really? Dr. Sarah looked out the window. Outside, New York's lights were shining. Ships in the harbor, traffic on the bridges, normal people living normal lives. Sarah replied, I used to save lives in a very different way. Now I use these hands only for healing. Mark nodded understandingly. He had sensed the military identity. Which unit? He asked. Sarah replied, classified. But I can say this, I used to be a deadly sniper. Now I'm a life-saving surgeon. Mark smiled. Now I understand. That precision, that concentration. How many confirmed? 73, Sarah said quietly. Mark's eyes widened. 73 confirmed kills. You're a legend. Stories about you are told in special forces. Sarah shook her head, I'm not that person anymore. That's in the past. Sarah warned, the people who attacked you were professionals. This wasn't a random clash. Be careful. And one more thing, if another case like this comes in, call me directly. Mark asked. Doctor, how were you able to move so fast? Normally such a critical surgery takes hours. Dr. Sarah raised her hands. These hands had been trained for different purposes for years. Sarah explained, because these hands used to hit targets from 800 meters away for years. Now I use the same precision to save lives from 2 centimeters away. Everything I learned in sniping, breath control, heartbeat calculation, concentration techniques, precise motor control. All of it can be used in surgery. Her last words were, there's no difference, only the purpose changed. 3 months later, Mark saw Dr. Sarah again at the hospital where he was getting physical therapy. This time Sarah was working in the emergency room. Mark approached her, Doctor, how are you? Sarah smiled, I'm fine, Mark. How are you? How's the physical therapy going? Very good. I'm returning to duty next month. By the way, we caught the people who attacked me that night. Turns out it was an international assassination team. The reason they targeted me was because of the narcotics operation we were running. Sarah nodded, I suspected. Those bullet positions weren't random. Mark continued, "Doctor, don't you ever miss it? The old days. The adrenaline, the action." Sarah thought, "Sometimes I miss it. But now there's a different adrenaline. I get the same satisfaction from every patient I save. Maybe even more." 6 months later, Mark had fully recovered. When he came to thank her, he found Dr. Sarah talking with other doctors. Dr. Michael Chen was speaking. "Dr. Williams, you've performed 127 surgeries this year. 100% success rate in all of them. This is a record in New York. Even rare in America. How is this possible?" Dr. Sarah smiled and replied, "I used to hit targets. Now I save targets. There's no difference, only the purpose changed. Both require the same precision, the same concentration, the same determination." Dar. Chen asked in amazement, "What do you mean?" "That's a very interesting comparison." Sarah explained, "There's a lot of similarity between sniping and surgery. Both require millimeter precision. In both, you need to do it right the first time. In both, lives are at stake. In both, the slightest tremor leads to disaster. In both, perfect concentration is essential." Dr. Sarah was now known as the ghost surgeon as she entered the operating room. She had become a legend among hospital staff. Nurses talked about her like this, "Dr. Sarah's hands are miraculous. No trembling, no hesitation." Young doctors came to learn from her, "Doctor, how do you achieve this concentration?" Sarah always said the same thing, breath control, heart rate regulation, and most importantly, seeing your target clearly. The patient's recovery should be your target. Everything should focus on this target. Sometimes while walking in the hospital corridors, she remembered that night 8 years ago. Syrian border, windy weather, 847 meters distance. That night she had taken her last shot. But actually it hadn't been the last. Only the target had changed. She was no longer targeting death, she was targeting life. Dr. Sarah's story spread in the hospital, then in New York, then throughout America. Although her military background wasn't officially disclosed, she was known in the medical community as the miracle surgeon. The surgeries she performed entered medical literature. Foreign surgeons came to observe her. But for Sarah, the most valuable moments were when her patients recovered and were discharged. Every life she saved helped her make peace with her past. Lives taken in the past were now balanced with lives saved. This was the most important thing for her inner peace. Sometimes the most deadly talents in life can be used for the most beautiful purposes. And sometimes the darkest pasts create the brightest futures. Because real heroes don't emerge by hiding their powers, but by using them for the right purposes. Dr. Sarah Williams was the perfect example of this. She had transformed from a ghost sniper to a ghost surgeon, turning her deadly hands into healing hands. If this story moved you and made you believe that anyone can transform their darkest skills into their greatest gifts, smash that like button and let me know in the comments what hidden talents you think could be transformed for good. Subscribe for more incredible stories of redemption and transformation, and remember, sometimes our greatest weaknesses become our most powerful strengths. See you in the next story.